This is OMS Voices, an Amos podcast. I'm Bill Klaproth, and with me is Dr. Andrea Burke, who is here to discuss braces versus surgery, navigating the best path to your perfect smile. Dr. Burke, thanks for being here.
Thank you for having me.
Yeah, appreciate your time today. I know this is a very popular topic, so very interested to talk to you about this. So first off, can you explain the main differences between orthodontic treatment with braces and corrective jaw surgery, and when is each option typically recommended?
Sure. So orthodontic treatment typically refers to braces, and I think most of us are familiar with braces because a lot of young people go through a period of braces in their formative years, and some even younger children will go through having a palatal expander, for instance, or maybe having other types of headgear orthodontic treatments done. But essentially, the difference is that orthodontic treatment is typically used to treat more mild to moderate alignment issues, such as crowding with your teeth. And generally, it's going to gradually move your teeth into proper alignment so that both the upper jaw, the maxilla, and the lower jaw, the mandible, align with each other. And in doing so, braces, conventional braces, will use brackets and wires and that sort of thing, and you'll go into the orthodontist for adjustments. Nowadays, many people are familiar with clear aligner treatment, which is more Invisalign and that sort of thing, which a lot of orthodontists and dentists are providing. But essentially, braces are for dental misalignments, like I mentioned, crowded teeth, gaps, overbites, small overbites, underbites, and crossbites. And really, the role of the oral surgeon in that process is just the orthodontist needs help anchoring a tooth or stabilizing something, with a screw, for instance. Now, corrective jaw surgery, on the other hand, typically is combined with orthodontic treatment. So many patients will be undergoing conventional orthodontics with braces or Invisalign treatment or clear aligner treatment for comprehensive results. But corrective jaw surgery is a little bit different process because it involves the surgical repositioning of the bones, so the upper jaw and or the lower jaw, or a combination thereof. And it's really recommended for significant jaw misalignment, such as a severe overbite or a severe underbite, or asymmetries that can't really be corrected with braces alone.
Yeah, that makes a lot of sense. So obviously braces, as you said, are for more mild cases, but for more severity, things such as jaw misalignments, overbites, underbites, etc., that's when corrective jaw surgery would come into place. And often the two are together because when you do the jaw surgery, you're going to correct the smile at the same time.
That's
most
correct.
likely. Is that right?
Yeah, because functionally, you want to be able to chew and eat at the end of the day.
Yes.
And so that's the most important thing, is getting the teeth to fit together, which is why it's important for us surgeons to work with orthodontists in order to achieve the best bite, as well as for us, the surgeons, helping to achieve skeletal harmony.
Right. I like it. Skeletal harmony. And if you're a social media influencer, you got to have that smile, right? So important that way, right? You got to have that beautiful smile, right? Which you're helping us to achieve. So then, Dr. Burke, what are the key factors that determine whether a patient should opt for braces or consider surgical intervention for their dental issues? I would imagine there's an evaluation. How does that work?
So I would say most folks that come to us, surgeons, are coming to us from an orthodontist for a consultation because their orthodontist has probably said to them, we can correct your bite, however, your bite, underbite, overbite, et cetera, is too severe, and we think that with the assistance of surgery, we'll be able to get a better result. And so I would say that's how the vast majority of patients come to us. Now, I've had patients come from other dental providers, from their primary care providers, from their nurse practitioners, all sorts of folks who come and say, I have a bad underbite, I'd like to get this fixed. But typically, at that point, we will go and refer them back to an orthodontic provider because, as I said, that's typically how we will go about doing it. We can do the surgery without the orthodontics, but I find personally that the results aren't as predictable or as successful. And so that's typically what I would do in that case.
Okay. So generally, that patient is referred to you from the orthodontist.
Typically, yeah, most commonly.
Yeah, and then you'll do an evaluation, and then you'll make your recommendation of, yep, we need to do surgery, or I think the orthodontist can handle this, right? And here's my recommendation.
Most of our orthodontists colleagues, I think, are good at recognizing what they can and can't achieve through orthodontics alone. And so by the time we're seeing them, I wouldn't say we're convincing folks to get surgery, but it's more just planting the seed of this is what the surgery is. And I try to be very non-committal with most patients, at least initially, because surgery is a lot to understand. And when people are considering, I just want my teeth to be straight, they might not understand the implications of what a big surgery is going to be. So I will sort of backtrack and go back to explaining why we want our face to have proper facial proportions, proper harmony between the upper and lower jaws, and other things that people may say, well, hey, you know what? My chin really has bothered me. Is there anything you can do about that? Or other sort of cosmetic issues, which often can get incorporated with orthognathic surgery. So, it's really having a discussion with the patient about what their goals are, what they'd like to get out of it, and then going over, what the surgery is, what the risks are, what the benefits and alternatives are, as you would any surgery.
So if an orthodontist refers a patient to you, generally, you know that it's pretty severe then.
Yeah, typically it's already kind of been decided that this is something that if they want to really pursue the ideal treatment, this is what is being recommended to them.
Right. And then you'll go over all the options with the person
Yeah.
so they fully
Yeah.
understand what all of this entails, because they may decide to opt not to have it. Oh
Exactly.
gosh,
Exactly.
I just wanted to fix this area. I'm not ready for jaw surgery at
Yeah.
this point.
And that's fine. I mean, if they want more information, I'm happy to give it to them. What I will say is that we find that folks who have the surgery at a young age never really complain, oh, I'm upset that I had the surgery. Whereas we end up seeing a lot of adults later in life who say, oh, I was told that I might need the surgery, but we didn't go through it. And now I'm back and I want to have the surgery.
Mhm.
And so,
Better to do it when you're young.
yes.
All right. If mom and dad says yes, do it, right? So can you share some success stories or case studies where patients have benefited more from surgery compared to braces or vice versa, so we can kind of get an idea?
Sure. I mean, one patient in particular comes to mind. This was a young woman who otherwise had pretty normal facial proportions, but had a very severe open bite from a malocclusion that her jaw had just sort of grown this way. And as a result, her chin was deviated over. And
So an open bite is,
an open bite is where your teeth don't touch in the appropriate sort of cusp to fossa. So those mountains and valleys between the teeth that come together, they don't align appropriately. And
Okay.
so you can imagine it's just open and the teeth aren't touching. And so functionally, that could be quite difficult,
right.
both for the teeth as well as your jaw joints. And so that's why it's important to have everything aligned. And so this patient just wanted her teeth to touch at the end of the day. And it actually was quite a challenging case for me because I felt like this is a woman, she's very pretty. I don't want to change anything necessarily about the way she looks, but she does want to functionally have an improvement. And we ended up doing the surgery. And I mean, she was over the moon afterwards just because functionally she was finally able to eat and chew. And it was a very good success story in that sense. I would say some of the other cases that are always kind of the most instant gratification are those cases that we do that involve sleep apnea. So we do a lot of this sort of surgery to specifically advance the lower jaw in order to open up the airway space. And sometimes we do it in conjunction with the upper jaw as well. And those patients, I would say almost always immediately can feel the sense of, I can breathe a lot more clearly, despite the fact that they're congested from the surgery, but they tend to have a lot of success from that. And that's what research has shown as well. So,
Yeah, those are great stories. So thank you for sharing. And that first story, I imagine, like you said, chewing, having the teeth touch where they're supposed to touch. I mean, she probably had certain quality of life issues up to
mhm,
that point and stressing out about chewing. So
for sure.
that's a great story. And of course, sleep apnea affects so many people in our country. Giving them relief just got to be a great feeling for you when you do those types of procedures,
hmm
for sure. So let me ask you this. How do the recovery times and long-term outcomes compare between braces and jaw surgery, and what should patients expect during their treatment journey?
So, conventional braces, the treatment is typically anywhere between 18 to 24 months, so approximately 2 years or so. And you go in occasionally for adjustments and checkups with the orthodontist and their team. And I would say generally there's some mild discomfort after the adjustments, but the risk of complications is fairly small. I mean, at most, maybe a bracket will pop off or something. But I would say the long-term outcome includes a well-aligned smile and improved dental health. And that's really the reason to go about doing it. And more or less, this is happening in periods of growth. So as we mentioned before, in children who are still growing and adolescents. And that's really the best time to consider doing the braces. Now, jaw surgery, I always tell patients, is about a 3-month perioperative period. So the initial recovery time is usually a few weeks after the surgery. And then the full healing, meaning the bone sort of remodeling itself and healing, can actually take up to several months, even up to a year in some cases. And we're detaching a lot of the muscles. And so from a functional standpoint, it's difficult to open your mouth. It's difficult to speak. It's difficult to eat. And we're putting you on sort of a liquid diet at first and then sort of a mushy, soft chewing diet afterwards. So that's a little bit hard as well. As with any surgery, there's more complications. Obviously, infection, I would say, can occur. It typically doesn't affect the long-term results of the surgery, but often will need antibiotics. I would say significant functional and aesthetic improvements are really the goal of everything. Other complications like bleeding, pain, that sort of thing, I think most patients are willing to accept. Really, the long-term outcome just is for enhanced jaw function and improved facial symmetry.
Yeah. Well, it seems like it's worth going through the recovery period. I know the recovery period for dental surgery is a little shorter. You said definitely months before you're back to normal, and braces can be 18 to 24 months, potentially 2 years. But afterwards, I would imagine your patients are like, gosh, I'm glad I did this. I'm really happy with the results.
Yeah, generally speaking, I mean, at the end of the surgery period, they want to get their braces off and often have to stay in them for, a period of time just while the orthodontist is finishing off the case. So that's kind of a struggle. It's,
They're like,
hurry up and take these things off.
That's how I'm ready.
Exactly. But I think once you've committed to the process, understanding how long it takes to get to the point of having the surgery and then going through it all, I think most people in the end are happy that they went through with it.
Yeah, absolutely. So let me ask you this. With advancements in dental technology, how have braces and surgical techniques evolved in recent years? And are there new methods or innovations that we should be aware of?
Yeah, I mean, I would say when I was training 15 years ago, we were still doing everything by hand in a laboratory with stone models and everything. I think the first thing that comes to mind is just we're doing everything over the computer now. So we're scanning people's teeth digitally. We're uploading those scans. We're taking CTs now of every patient that we're doing surgery on. And we're using these virtual planning softwares in order to sort of create the surgical guides that we used to create by hand in order to place people's bones where we want them to be and align their teeth. The other big advancement has been really the clear aligners, as I mentioned, for instance, Invisalign, which I think many more patients are willing to accept going through the orthodontic portion of the treatment with the clear aligners because they're a little bit more discreet. And we can do the surgery as the patient is going through clear aligner therapy. There's other orthodontic advances like self-ligating brackets, which can reduce treatment time and discomfort. But really, it's, the advancement and all the digital imaging that I think helps the most. As far as other materials and things, there are some biodegradable materials that can help with some fixation methods. Generally speaking, I think the materials that we use, which are most commonly titanium plates and screws, are all very well tolerated. It's very, very rare for anyone to have an allergy to those materials, and they withstand the test of time. So I think in that sense, that's been really great. Just at our recent national meeting, we've been discussing a lot about artificial intelligence.
As everyone is.
The treatment planning of a lot of these sorts of surgical correction cases. And so I think we're going more and more toward personalized medicine, personalized treatment. And so in doing this virtual surgical planning, as I mentioned, we're making more patient-specific guides, patient-specific hardware, which I think it still has a little way to go, but more and more people are incorporating that into their practice. More hybrid treatments combining both braces and surgery for various types of dentofacial deformities, and really just helping to educate our patients, being able to show them, in a digital treatment plan of this is what you look like now, this is what we're planning on looking like. And I think with time, that's just going to get better and better.
Absolutely. And the more personalized you can make it, the better for the patient and probably better for you because it's a lot more targeted with all of these advancements, I would think, helping you do your job a little easier, if you will.
Yes. And I would say it reduces surgical time. So far, it's been shown to maybe reduce complications, hospital stays, that sort of thing. And that's what a lot of the research surrounding that is on right now.
Well, better outcomes are always good. Well, this has really been fascinating. Thank you so much for your time. Anything else you want to add before we wrap up?
Just that I think that in many cases, patients get very overwhelmed hearing the word surgery, and that they should not feel that they have to commit to doing the surgery. It is an elective surgery. But as I mentioned, I have never heard an adult say, I'm really sad that I had this surgery as a kid, whereas I've had numerous patients, now we're treating a lot of adults with orthodontics, and many of those patients sort of say like, oh, I wish I had known about this beforehand. And so I think that it's definitely something to consider, but it's a long process to be in braces for a long time, a long commitment. And so I always encourage my patients to write down their questions. And I think that things like this podcast are a wonderful opportunity to get more information.
Totally agree. And thank you for that. And I think it would be fair to say, even if you are an older person and you've never been happy with your smile, or maybe there's something wrong with it, like the teeth not touching or something,
Yeah.
I would encourage you, just go and see an OMS or an orthodontist.
Exactly.
And if you're unhappy with it, just do it. This isn't for, 10 to 30-year-olds. It can be for any
anyone.
age.
Yes.
Yeah, that's great advice. Well, Dr. Burke, thank you so much for stopping by. We appreciate it.
Thank you. I appreciate it.
Yeah. Once again, that is Dr. Andrea Burke. And for more information in the full podcast library, please visit myoms.org. And if you found this podcast helpful, please share it on your social media and don't forget to subscribe. Thanks for listening.